think the attendees have slowed down a little bit, at least those joining. So I will, let's get started. I'm Patrick Nelson. I'm a principal at Santis. Thank you so much for joining us today. Days after the release of a provincial budget and just days away from the writ being dropped here in Ontario, we thought it was a great opportunity to give you a brief update on all things related to health in the province. I'll be your host today, and I'll be joined by two of Santis's finest. I'll let you read their bios on our website, but Dan Carbon and Stephanie Gower, thank you both for joining us today. Before we get started, some brief housekeeping. If you have a question, you can use the Q&A function at the bottom of your screen. We'll endeavor to leave enough time at the end to answer all of your questions, so please get them in there as soon as you can. After our presentation, we'll send a recording and the slides out to registrants. If you're looking for a personalized presentation to your organization, to your board, to your senior management team, please let us know and we'll see if we can make that happen quickly in the next couple of weeks. At the end, we'll also send out a short survey in the hopes of hearing how we can make these better in the future. Lastly, we have developed a health-specific election tracker for Ontario that is hyper-focused on health, which we'll walk through in more detail at the end. Most of you on the call have used our services, but it's possible you aren't aware of the full breadth of services that we offer. With almost 40 people and offices and relationships across the country, we have full service teams in government relations, communications, and strategy and policy development. If you're interested in learning more about a specific service area, let us know and we'll set something up. It's our shameless plug. Next slide. The agenda, I'm going to kick us off with a look at some recent polling on key issues and on voting intentions and how the numbers look as we get closer to the writ being dropped. Dan will talk through what's most pressing in the health system as we move out of the pandemic and onto other health issues. And then Steph will walk us through the health portion of the budget that was introduced last week and what we know so far about the party platforms related to healthcare and where we go from here. Next slide. So you've all seen recent polling, at least most of you have, and this snapshot on voter intentions from 338 Canada confirms what we've been seeing for the last couple of months anyway. Ontario PCs have a healthy lead going into the election. As a party, the Liberals are running higher than they have in some time, but in a few slides, I'll show you how the favorability of the leaders is quite different. Bottom line, it's the PC's election to lose at this point. But one thing we know about pre-writ polling is that campaigns really do matter. Elections can be won or lost during the writ period. We also know that the focus on the leaders of parties gets dialed up significantly during a writ, so these numbers can change and are likely to change. Next slide. More than I can remember, there are a lot of long-standing MPPs who aren't running in this election, and even some senior cabinet ministers. 13 PC MPPs, many of them in safe seats, won't be running again. Not sure it will have a dramatic impact on those ridings, but most certainly will have an impact post-election if the PCs win. Cabinet is likely to look pretty different, and most important to us, regardless of who wins government, we will have a new Minister of Health with the departure of Christine Elliott. Next slide. So here's the party leaders. I'm not going to spend a lot of time telling you about them other than to say that obviously the Premier has the most to lose. But as we'll see on the next slide, all things being equal, it's the race between the NDP and the Liberals that will be most interesting to watch, I think. Remembering, of course, that the big winners in the last election were the PCs and the NDP, who gained almost 50 seats and just over 20 seats, respectively. The Liberals and Premier Wynne lost almost 50 seats. So it's hard to imagine the Liberals staying that low, but where will they gain their seats, and can the Premier and the PCs hold on to what they have or even grow? Next slide. These numbers are from Abacus about the impression of party leaders. Elections put a giant spotlight on party leaders, so all the numbers are important. In particular, the green and the yellow, the positive and the negative. But what often goes unnoticed sometimes are the blue, the neutral, and the don't knows and the black. The Premier has many who love him, and equally those who don't like him so much. This isn't abnormal for a premier. Key to his numbers is the absence of those people who are neutral or don't know. Precisely why you're feeling pretty good if you're the PCs right now. People have generally formed their opinions of this premier, and roughly half think he's pretty great. Things can change, of course, during election period, as we know, but it would have to be something significant at this point to see some significant movement. Andrea Horvath is also a known entity. She's been doing this for 4 elections after all. But again, roughly the same who have a positive impression also have a negative impression of her. She has some room to grow on either side based on those in the neutral and don't know categories. Stephen Del Duca is the one that sticks out for me the most on this slide. He remains a very unknown entity. Almost half of those asked don't have a strong impression of him. Of those who do, 5% more have a negative impression. This would be concerning for his campaign team. If you think back to the 30% who chose the Liberal Party over other parties, you would expect they'll be trying hard to run more as a team and a party rather than profiling the leader. But again, this is tough work during an election when the spotlight is so big on the party leaders themselves. Can he win over those who have yet to form an opinion of him? Remains to be seen. Next slide. So let's dive into the premier's numbers a little bit more. I'll draw your attention to a few quick ones. The first, leading the province through a pandemic at the top. This one is somewhat surprising. If you focus solely on sort of Twitter and critics and social media, you'd think the premier had made nothing but terrible decisions during the pandemic. However, if the numbers tell a different story, if we add the excellence and the acceptables together, more than 60% feel he's done a pretty good job in leading through the pandemic. Almost double those who think he's been poor or terrible. Managing the health system, third down the list on the slide. Again, more than half think the premier's done a pretty good job managing the health system. Great news after the pandemic that we've seen, but also good news because PCs don't tend to fare as well on social issues as they do on pocketbook ones. Although we're more focused on health, I'll also just briefly note the 2 at the bottom. On cost of living and more affordable housing, the premier has less people thinking he's doing an excellent or acceptable job than who think he's doing poorly. This likely explains a little bit the focus on affordability in the budget and many of the policies that came with it. And Steph's going to walk us through the budget a little bit later. Next slide. Last slide on the numbers. Just a quick glance at what issues are most important to voters in the next election. Again, telling for what we expect to hear about for the next 4 weeks. Cost of living and housing affordability at the top of the list. Likely why we're seeing a giant focus from the PCs on those issues. And I expect we'll hear more. And then as we go down the list, improving the health system, responding to the pandemic are further down. Long-term care remains way down the list, despite the efforts of the NDP and the Liberals to keep the issue on the front burner. My sense is that we'll see an election fight between 2 competing issues, affordability and healthcare. On health, I don't think the PCs are afraid to fight on health issues, as they spent the last few years and the last few months in particular trying to insulate themselves. And as noted, the premier fares pretty well on the key health issues at this moment in time. That said, and perhaps if you're a Liberal or NDP, it's exactly why I think they'll be spending a lot of time trying to reshape or change the current positive perception of the premier's record on health in the pandemic. And I think we'll start seeing ads and a narrative that tries to reframe that significantly. And with that, I'll pass it over to my colleague, Dan.
Thanks, Patrick. So I'm going to spend just a few minutes providing a high-level overview of what we see as the 5 top areas of strategic focus that any provincial government is going to have to focus on over the next 4 years. You know, we're spending most of the time today talking about the campaign dynamics and Stephanie is going to be following me talking about the budget and the election platforms of the different parties. There is a bit of a difference from what parties talk about during a campaign and what they do as government, though. And what I'm going to be presenting is the 5 areas that, whether it's the NDP, working with the Liberals or the Progressive Conservatives, emerging from government this summer, they're going to have to tackle these 5 issues in order to have credibility as a government that is primarily responsible for healthcare, along with education and a few other services at the provincial level. The first thing we'd like to highlight that any government will have to tackle, and it's been getting increasing, I think, resonance in the media, but you're also seeing it whenever you talk to someone that's running a hospital, running a home care organization, a community support organization, a long-term care home. The number one thing that they want to talk about these days is the difficulty in recruiting and retaining staff. You know, we've known for a long time that health human resources is going to be a multi-decade problem. The workforce as a percentage of the population is shrinking. The number of people who are aging, needing care is growing. And healthcare is ultimately a people business. You can't provide care unless you have people to provide care, despite the advances in AI, despite the advances in robotics. You need people to deliver care, and most of the spending in the healthcare system is actually on people. That's what, and you've seen recently, you know, the government putting a lot of money into focused initiatives around topping up pay for nurses, topping up pay for PSWs. But I think what you're going to need to see over the next 4 years is a much more comprehensive, coordinated approach that, instead of responding to the latest crisis that's popping up in hospitals or long-term care or home care, takes a systematic, comprehensive view and looks at, you know, not just at the provincial level, but also at the federal level. How can governments work together and work effectively to address what is going to be a multi-year, multi-decade challenge in health human resources? And many of these things can't be fixed overnight. We can increase the number of medical school spots, we can increase the number of nursing spots, but this is going to take sustained focus over the term of not just one government, but many governments to address. And COVID has really just taken this to a tipping point where you're hearing from hospitals, you know, we have 500 vacancies. You're hearing from home care organizations that they can't find the PSWs to staff visits, and people aren't getting the care they need. So COVID has shown a spotlight on the need to do more on health human resources in a more comprehensive, thoughtful, and holistic manner. The second priority, if we move to the next slide, is really this focus on system capacity and surgical backlog, which again, COVID has revealed as an area of necessary focus. Canada has tried to run its healthcare system for as long as possible, as close to the edge as possible. We want our hospitals, generally, we wanted them to run at 100% capacity. We've wanted them to run at 105% capacity or 110% capacity. We've wanted to have people on surgical wait lists because that is highly efficient from a financial perspective, to have all of the assets in our system mobilized to deal with care. Of course, it is catastrophic during a pandemic when we don't have enough ICU beds and we have to shut down the broader society because our hospitals are at risk of closure. And I think one of the lessons of COVID, I think that our policymakers are taking on board, is that we need to invest more in capacity across the healthcare system, in home care, in primary care, in hospitals, in long-term care. And you're starting to see that the reinvestment in infrastructure, in ICU beds, and in other parts of the system. But it's going to take years to address this. The surgical I think Kai put out a report in November, December saying surgical volumes across Canada were down in a year by something like 500,000. Lots of people didn't get screening. Lots of people haven't been diagnosed. So there's people on the wait list. There's hundreds of thousands of people who are not yet on wait list for care. And how we're going to care for these people is really going to be a multi-year challenge that the whole system is going to have to take on. Building this capacity to take people in through the front door of the system and then provide them care all the way through is going to be another multi-year challenge for a government. And this is going to, I think, increase over the next year or two in terms of the public focus on people not being able to get in to get care in a timely manner, something that Canada's always done a pretty poor job of, to be honest. Next slide. The third area that we focused on is really unsurprising: mental health and addictions. Mental health and addictions, if you turn back 4 years, the two major areas of healthcare debate in the last provincial election campaign were hallway healthcare and mental health and addictions. All of the parties made major funding commitments in mental health and addictions, and that was before COVID. And what we're seeing now is that mental health and addictions has turned from something where we might have thought of it as individuals struggling with problems to something where, as a society, we are sick from a mental health perspective. Angus Reid just put out a poll saying, in Canada, 54% of the population thinks that their mental health has gotten worse since the beginning of the pandemic, compared to only 12% who've seen it improve. The CMHA has recently put out a large study across the country documenting significant problems to be accessing the mental health and addiction system. And this is on top of a system that prior to COVID, we are dealing with an opioid epidemic and mental health access problems across the board that this government and others before it have really been putting a lot of money into trying to address. But there obviously a lot more needs to be done on mental health and addictions, and it'll be a focus for the next government and subsequent governments. The next slide, please, is seniors care. So early in the pandemic, the focus on seniors care in Canada was really on what was seen as the failings in the long-term care system. Early in wave one, the 80% of the deaths in Ontario were associated with long-term care. There was a lot of public kind of backlash about conditions in long-term care and the need to invest not just in the physical plant of long-term care, but the care provision. So the government has invested significantly in commitments to redevelop long-term care, build new long-term care models, sometimes in partnership with hospitals, and increase the staffing to 4 hours of care a day in long-term care. Longer term, though, I think what we're starting to see is that there needs to be a more comprehensive plan that doesn't just include that residential care and long-term care, because essentially what these commitments are doing in long-term care is increasing the per capita cost of long-term care. Long-term care is going to get potentially better and more staff for individuals, but it's going to become more expensive. Lots of people aren't going to end up in long-term care, and we need a comprehensive plan to care for those folks in the community as well. So you've been seeing recently a more thoughtful kind of comprehensive plans that include not just the long-term care component, but also investment of home care and community-based care to build out a true continuum of care for services in the community. One of the key kind of political flashpoints on this that Stephanie, I'm sure, will reference and might come up in the questions and answers is the question around the nonprofit for-profit status. This is perhaps not as important as many of the structural design questions around how we structure seniors care and what we invest in, but it's an incredibly potent political flashpoint for parties to be able to debate on in terms of values in an upcoming campaign, which is why you've seen the Liberals and the NDP really pushing for a move away from for-profit delivery in long-term care and in some cases in home care. Next slide. The kind of final thing we wanted to highlight is healthcare is obviously expensive. It's a large part of our GDP. In 2020, we increased health spending in Canada the most of any year on record. Of course, there's a very good reason for that, but health spending went up 13% across the country, according to CIHI, and those investments, although they've slowed down a bit over the past year, we don't expect healthcare spending, especially given all of the needs that are so blatantly obvious, to go back to the level that it was from 2010 to 2020. There's a real public, need to see improvement in the healthcare system, a hunger to see more investment in healthcare. The question is, who's going to pay for it and where's this money going to come from? We expect over the next 4 years that you're going to see more contentious discussions between the provinces and the federal government about the fair share for healthcare. That certainly will pick up after the election in Ontario, as Ontario gets involved in figuring out who's going to pay for some of the things that they've committed to. But there's also going to have to be a look at who is paying in Ontario for healthcare services. Are we going to have to look at the healthcare financing model again if we want to add a whole host of additional services in? Are we going to have to increase taxes or those kinds of things to be able to pay for some of the healthcare commitments that are going to be coming down the line over the next few years? So this is going to be the kind of fifth multi-year trend that we see in the healthcare system management. Now I'm going to hand it over to Stephanie, who's going to talk about the budget and the health commitments from the parties.
Thanks, Dan. And just a reminder for everyone, you can start asking your questions in the Q&A. We already have a few questions coming in, and we'll address those after I wrap up this next section. So next slide, please. The government tabled, after a bit of a long delay, their last budget of the legislative session late last week, which really marked the unofficial start to the election campaign. And the budget will act as the PC's platform, highlighting the massive investments made into healthcare, many of which I think were, made reactively to the COVID-19 pandemic and not as commitments from the 2018 campaign. Dan and I were talking about this earlier, and it's hard to believe how much has changed in the last 4 years from the last election. And the only commitment on healthcare was ending hallway medicine. So, it's a substantial focus that nobody expected. But over the past few months, we've seen the government really pivoting from that sort of COVID response to the reopening and making life more affordable and livable for Ontarians. And this will continue throughout the election campaign for the PCs. This notable shift from COVID and healthcare focus in the budget really, a lot of the emphasis was placed on infrastructure projects like building Highway 413, investing heavily into auto and manufacturing sectors to bring new jobs to Ontario, and sort of pocketbook issues such as the refunds for driver vehicle registration fees and focusing on affordable housing. From the healthcare perspective and lens, the budget topped up the already vast spending with an increase in hospital capital funding by an additional $10 billion and a massive investment into home care, with the rest of the healthcare spending pretty much allocated already in projects that the government had announced over the last year. There was some confusion on budget day about the government not passing this budget if re-elected or tabling a new revised budget, but the minister did clarify this to say that the budget tabled on April 28th is intended to be reintroduced if the PCs are re-elected, and the budget will be reintroduced in its entirety. The government will need to have a speech from the throne and then retable the budget bill. And our current intel suggests that this will not happen until fall of 2022. There was some thought that they could sit for another week after the election if re-elected, but everything is aligned for the fall of this year. Next slide, please. So the next few slides, I'll walk through current platform commitments. Just one note that as of today, the Liberals have not published their entire platform. They have hosted a series of campaign style announcements, and some of which have been focused on healthcare announcements. So, the list is not complete as of yet for the Liberals. And for updated platform commitments, please visit our election website, which will be updating daily. So as that platform is released, we will be updating the policy sections. So as Dan highlighted, top of mind for everyone is the massive surgical backlog as a result of the pandemic. And, many regions across the province, I think we're still, hospitals are still operating at a reduced surgical capacity to manage HHR staffing issues, especially as we're just sort of exiting this last wave of COVID infections. So the PC government has already released their surgical backlog plan. In the budget last week, there was, as I mentioned, increased funding for hospital infrastructure, surgical diagnostic backlog, and they included an additional 150,000 MRI and CT scan hours in the budget last week. They also highlighted the vast investments into hospital infrastructure for the next 10 years, increasing capacity by 3,000 new beds, and highlighting the over 50 major projects such as Brampton, Windsor, Essex, expansion and redevelopment in Scarborough, as well as 250 million dedicated to HHR and staffing. So compared to the NDP platform, which they released last week, the NDP have increased all of the hospital funding, and they haven't, to date, they have not attached a dollar figure to this as they were waiting for the PC budget to be released. But they're expanding on all projects that the PCs have already announced. So you can really see some targeted platform commitments on the priority regions and ridings that they're expected to be in close races with. So Brampton, Niagara Falls, Windsor, Essex, Kitchener, and they have committed, the NDP have committed to begin working on new hospital projects in Brampton, Scarborough, and Sioux Lookout. And to this point, the Liberals have not released any information on the hospital or surgical backlog plans. You'll notice on the slide that we are highlighting Ontario Health. Ontario Health was not in the 2018 election commitments document from the PC party. And I think we just wanted to highlight it here as many stakeholders have been wondering what happens to Ontario Health or OHTs post-election, especially if there's a new government elected. And I think to date, all main parties have committed to maintaining Ontario Health and the structures, as there are substantial projects continuing throughout the election time and into the summer. But if a new government is elected, it is a time for them to make any adjustments, tweaks to anything under Ontario Health or Ontario Health team structure. But to date, there is no indication that they would scrap, any of the parties would scrap it or change it significantly. Next slide. So COVID-19 pandemic response, the PC's plan to stay open, which was announced prior to the budget, but included in the budget, had fairly significant dollars attached to it to improve emergency readiness, PPE supply, delivering access to testing, improving vaccination rates across Ontario, and social supports for the hardest hit areas of the pandemic. They also released a framework of the roles and responsibilities of ministries during an emergency such as a pandemic, and also new legislation to have a provincial emergency management plan that will be reviewed every 5 years. So the plan has been out there, as I mentioned, for quite some time now, and the NDP are the only other party to put together a COVID response or emergency summary in their platform. And they're introducing new Emergency Management and Civil Protection Act and other pandemic-related legislation to strengthen the province's ability to respond to crises. They have a bit more of a focus on supporting small businesses, doing a bit more than the PCs did throughout the pandemic, expanding government-funded business investment programs, digital Main Street programs for nonprofits and charities. And so far, the Liberals have only announced the removal of corporate taxes for small businesses hit the hardest during the pandemic. Public health, which obviously was a central focus throughout the pandemic, has not received any new funding or focus by the PCs. This is the fourth budget in a row with no public health focus other than COVID and necessary investments for COVID-related matters. The NDP, though, however, have a substantial section in their platform looking to cancel the mergers of public health units, learning a bit more from local public health units on their pandemic response and to ensure and shape the plan that they put forward next. And interestingly enough, as we all know, the Chief Medical Officer of Health has been doing his briefings for the last 2 years, and the NDP would enact a Public Health Accountability Act to ensure that the Chief Medical Officer of Health is free to act in the public interest. So there's been a lot of politics with the Chief Medical Officer of Health, and the NDP is focusing on that in their platform. Next slide, please. So moving on to, probably the largest piece that was announced last week ahead of the budget. There were competing visions for the future of home care in Ontario. The government released their home care plan, and the opposition, NDP and Liberals, both announced their home care plans for the next few years. So the government, to summarize, announced their $1 billion over the next 3 years to expand home care services, which builds on the already allocated $548 million previously announced in the fall economic statement in 2021. The government's other major home care reforms delivered through the Act in 2020 and resulting in regulatory changes also came into force yesterday, actually on May 1st. And so both the NDP and the Liberals released their plans for home care last week, just after the government announced their $1 billion. And the NDP have taken the position, as Dan referenced before, to end for-profit home care and developing provincial standards for the sector and a province-wide caregiver benefit program. The Liberal plan would suggest that they would also increase annual budgets for home care by more than $2 billion and fund over 15,000 assisted living spaces, which really does set them apart from the other two parties in terms of assisted living. They would also create a new ministry for seniors, which would have coverage over both home care and long-term care. The government also increased base funding for CSS providers in the budget, and community support service providers, while the NDP made some vague commitments around community support services in their platform, and the Liberals had no commitments to CSS providers. So pivoting to long-term care, which has been a priority for the government and opposition and third-party stakeholders, obviously, for the last 2.5 years, the PCs remain committed to their plan to build 30,000 net new beds for long-term care by 2028. And the for-profit versus nonprofit discussion carries into the long-term care space as well for both opposition parties, and they're focused on ending for-profit long-term care, the Liberals by 2028, the NDP by 2030. So while every party has agreed on the need for new beds, new homes, post-pandemic, everyone agrees that this is a priority. The new beds and these massive commitments of over 50,000 new long-term care beds adds increased pressure from staffing, HHR needs, and it's still a massive sort of issue, as Dan flagged, that all parties have to really tackle, especially if they're looking to increase the long-term care and home care services in Ontario. Next slide. So mental health and addictions, obviously top of mind for, I would say, all Ontarians throughout the pandemic, and the government has recommitted to their record investment through their roadmap to wellness in 2020 and the same path that they previously laid out. The NDP have massive investments into mental health, investing 1.15 billion a year into mental health programs, which includes a universal mental health care plan to include counseling and therapy covered under OHIP. They're also creating a Mental Health Ontario, a new coordinating organization that will take the lead on public reporting on mental health needs, as well as a comprehensive waitlist for services, province-wide mental health standards, and a bit of a basket of services for mental health and addictions programs across the province. Also interesting to note that while the Green Party has not released their full platform, they have released a fairly robust mental health and addictions plan with expanded access under OHIP, funding for supportive housing, and a dedicated ministry for mental health and addictions. And HHR, as Dan touched on, and it's a common theme throughout all of these, throughout the pandemic, HHR has been a focus for the government, opposition parties, and third-party stakeholders. Again, just a reminder, the Liberals haven't released a full plan on this yet, so what is listed here is not complete. This is just through other announcements. Obviously, top of mind for both opposition parties is scrapping Bill 124, which many say has placed immense pressure on many organizations to retain staff and recruit staff. And while the opposition parties have outlined broad plans to hire 30,000 nurses or PSW, I think the question across all parties really remains what are these sources for recruiting this many people? And it just leaves us with a large question mark of how these giant targets are going to be achieved. And I would say from all three parties. Everyone acknowledges that this is a massive problem, but really, reading the platforms and the budget and sort of the commitments from all the parties, there's no clear plan on how to fix it. It's really just investments at this point. And I think we're all looking for a little bit more detail into how this is actually, how the parties are actually going to fix this. Next slide, please. So the PC government made clear their commitment to the life sciences sector in Ontario. They rolled out the life sciences strategy, again, pre-budget in March 2022. And there will be a new life sciences council to be named post-election. So the goal of the strategy is to increase, obviously, the number of jobs in Ontario's life sciences sector by 25% by 2030, looking at biomanufacturing, domestic resiliency and PPE, boosting commercialization capacity, and adopting Ontario-made innovations to improve healthcare. And the government is already underway with their life sciences strategy. The Life Sciences Council will not be appointed until post-election. But I think, conversations will continue after the election on this. No other party has any life sciences strategy or commitment to life sciences in their platforms. And just on pharmacare, the budget acknowledged continued work that was needed between federal, provincial, and territorial partners and other stakeholders to achieve long-term sustainability of public drug programs. So we read that as the PCs will wait on the feds to deal with pharmacare and see what comes next. And the NDP are the only ones, again, to date that have a commitment for pharmacare in their platform. The NDP of Ontario really praised the federal NDP for getting this done, but they do make it clear that 5 years is a bit too long for this and that the Ontario NDP will begin working on this immediately. So, they know that the feds are working on it. They think they can do it quicker. Ultimately, the feds are going to pay for this. So have a plan ready for Ontario. So that summarizes the platforms as they are to date. What's next? So next slide, please. We're going to look quickly at what the sort of post-election timeline looks like right now. So the writ will drop on May 4th. And the first leaders debate is taking place. This is a northern debate in North Bay, focused on northern Ontario issues. And really the next debate is the first official debate on May 16th. And I think location and all of that is still to be determined. June 2nd is the legislative election day in Ontario, and there's no plans to change that. So post-election, I think we can expect cabinet to be appointed, I would say end of June, early July. And then obviously ministers' offices start staffing up. I think there's going to be a substantial change across the board in terms of staff. You might see some, if the PCs are reelected, you might see some continuity amongst the PC Premier's office staff, but most other, especially looking at all of the MPPs that are retiring and ministers that are retiring, I think we're going to see a real new sort of staff come in across all the ministries. And then July, August, and really into the beginning of September is when the ministers' offices are all staffed up, MPPs and all the sort of mandate letters and ministerial briefings take place. And then September, I believe mid-September is when the legislature is technically set to resume with a speech from the throne. Again, the government can change this if they'd like to delay it. Second term, second mandate, they might take that chance, and not like 2018 when they sat all summer to really expedite a number of the issues that they were focused on. Next slide. So the major opportunities post-election, we were looking at this as sort of, the election is only 4 weeks long, and that's not a ton of time in terms of planning. As the polling stands right now, it does look like status quo, but a lot can obviously change in 4 weeks. But having your organizations ready to hit the ground running, post-election, post-cabinet appointment is really going to be critical. Building those lasting relationships with a lot of new MPPs. We're going to see obviously a new Minister of Health, but likely new Minister of Treasury Board, like all of those massive portfolios changed. So having the relationships with staff and the members is very important. Also identifying platform commitments your organization aligns with or doesn't. If there's something substantial that you need to be prepared to have those difficult discussions with government about, then take the next 4 or 5 weeks to do so. And if a new party is elected, there's obviously potential for a new budget, new funding commitments. So just keeping that in mind as we see sort of how the next 4 weeks unfold. And then start planning for the fall and winter. Post-COVID, the legislature will be going back to lobby day, in-person receptions. It's a good opportunity to, build those lasting relationships and have your organization front and center for when the legislature returns. Next slide. This is just a reminder that any organization, entity that is not a political party or candidate that engages in political advertising and spends more than $500 on political advertising needs to be registered with Elections Ontario. So if your organization is publicly commenting on a specific party leader or MPP, calling to action, sort of grassroots who you should not vote for, and your organization is saying that, or if you're paying for television sponsored content, online social media content does apply here. So we can share more details on that if you have any questions around third-party advertising. Next slide. And I'll end here. So as Patrick mentioned, we have launched the Santis Election Tracker. The election website is updated every morning by 9:30 a.m. and it provides you with the latest provincial polling, the campaign trail news, so the party leader itineraries, our daily insights on healthcare specific announcements. And then we also provide you with a platform commitment tracker, and you can sign up for the candidates list, which we are continually updating with all candidates, campaign office information, websites, anything that you would need to reach out to candidates. So please visit our election website, santishealth.ca/election. And if you have any questions, please let us know about that. So now I will turn it back to Patrick.
Thanks so much, Stephanie, and thanks, Dan. So we've got 3 questions that we'll get to. But there's certainly time for more. So if you have a question, please get it in the Q&A and we'll get to it in due course. So for the first question, Steph, I got to look to you and to pull out your crystal ball. I know we keep getting this question and I'll let you bear the brunt of being right or wrong. So any idea who the next new Minister of Health will be?
Yeah, I think, again, everything is speculation at this point and depends on the results on June 2nd. I think that there are some key portfolios that will remain. Minister of Finance will likely remain in his role, economic development, and maybe even Treasury Board. But there's a lot of new star candidates, if we want to call them that. Brian Saunderson in Collingwood, Simcoe Gray is technically the riding name, former mayor, good relationship from my understanding with the premier. That could be someone we're looking at. And so I think, we have to keep sort of all options open, see who wins. I think the PCs are poised right now to win some new seats as well. So it depends on really who wins. I think regardless of the minister, it will be a lot different than the last 4 years, and we have to be prepared for that.
Yeah, maybe I'll just add some color to that, Stephanie. Just putting aside the who, when I think about the character traits of who the next Minister of Health would be, the next government will have to make a decision. Do they want a change agent? Do they want to be focused on deficit reduction and reining in healthcare spending? Or do they want someone that's more of a maintenance person, which I think, we can debate it. Christine Elliott certainly did gigantic change to the healthcare sector, but it was generally quiet. So to me, that's the question that they'll have to ask themselves. And then the person to fill that role will be the next, will help them answer who. Next question is from someone who clearly works in the long-term care sector. It feels like we are constantly being denigrated. Does the wider public have that negative perception overall, or is it simply amplified by the rhetoric and the media? Dan went a little bit into how I might answer this. As many of you know, we certainly have done a lot of work in the long-term care sector, in particular over the last couple of years. So we've been in the trenches with a handful of the operators. I think the first part of this is time. Time has certainly healed, I think, some of the negative perception in long-term care. We saw that number on one of the earlier slides, just about what the top 3 election issues are for voters, and long-term care was near the bottom at 18%. Put it differently, only 18% of those who answered the survey put long-term care on their top 3. So I think that says something about time. I think the second part of my answer is just about all of the investments and work that has happened in long-term care over the last couple of years. And Steph went through the list. There's been, the hours of care has been increased significantly. They're certainly hyper-focused on HHR. Building beds and modernizing beds. Over the last month, we've seen dozens and dozens of announcements around the province. And perhaps the showcase, I don't think we would ever have imagined that a government / Lakeridge Health could build build a brand new long-term care home from start to finish in 13 months. So that's pretty significant. So I think that those kinds of investments, the focus on more of improving things, probably has de-escalated that. And I highlighted this, maybe the last part of this question is just that's not to say that we're not going to continue to see the Liberals and NDP try to make long-term care an issue and to remind voters of the first part of the pandemic. And I think, without going too deep into the for-profit versus not-for-profit, Del Duca's new announcement last week just about making getting rid of the for-profit sector in long-term care, to me, seemed less about policy and more about politics and refocusing attention on long-term care in the hopes that it can put a chink into the Premier's reputation at this important, critical moment. Next question. I think this one's best answered by you, Dan, but Steph, feel free to jump in. Renewed negotiations with the federal government on health funding are likely to happen post-election, with so many capital redevelopment announcements, both in hospitals and long-term care. Do we expect that the federal infrastructure funds would be attached to any new agreement with the provinces?
Sure. So I'll give a shout out to Peter Cleary, who runs our federal government affairs practice, and has messaged me on this question when he saw it pop up. And essentially, health transfers in the past haven't included an infrastructure component. If you look back to the Paul Martin Accords or the 2016 investments, it's all been tied to operational funding, which is somewhat different than how the federal government has partnered with the provinces in other areas where there has been a 50-50 cost share between the province and the federal government on areas of infrastructure. I think what we can expect is, unless the provinces come together and make a compelling case that this is an area where the federal government would need to put investment forward in future discussions, it is unlikely that this would be a big focus of federal government investment. They've talked much more about long-term care operational standards and funding to support that, and investments in home care, investments in mental health and addictions, and you could even see them providing some targeted investments in health human resources. If the provinces really wanted money for infrastructure for healthcare, I think they'd have to make that as a compelling case and change the historical dynamics of the health transfer discussions.
Anything to add, Steph?
I would just say that I think, in terms of long-term care, the federal government seems to be stepping a bit away from it right now. I think the, development of national standards was a knee-jerk reaction during the pandemic. And if I can say that the future of those standards is pretty unclear at the moment, right? And so Ontario, if we're putting it back in the Ontario context, we're ahead of most of the other provinces in terms of developing reforms. I mean, there's still a number of issues that need to be resolved, but yeah, it's going to be unclear, I think, for the next 6 months to a year on this, really, on how integral the feds are, specifically to long-term care in the provinces.
Yeah, I would just add one little piece. Pre-pandemic, the feds certainly had a big envelope of funds for affordable housing and for housing, and they were quite reluctant and resistant to pivot any of those investments into long-term care. And I guess we'll see post-pandemic, and to Dan's point, they've certainly made some commitments and funding, but we didn't see any of that funding in the last budget. and we'll see how the coming months unfold as far as how far those standards go and how much they're willing to spend. Next question. What is the biggest gap, omission in budget or platforms that you're surprised hasn't been talked about yet that you wish was being talked about? I'll have a quick answer, and maybe I'll send it over to you, Steph. I certainly have been on HHR. It's the one that sticks out for me. Steph's heard me talk about it before, but the most of the parties are just talking about doctors, nurses, and PSWs. And there's a reason for that. They have big audiences, and if you go into an election fighting any of those three, there's more risks that come. Obviously, I don't think what we've seen in any of the platforms yet is a real focus on those other providers like pharmacists, nurse practitioners, physician assistants, and optometrists, and how they can be used in a different way going forward. And it's certainly something that we have all heard about for decades, and there's been varying degrees of movement, but that's one that I would expect should be a focal point post-election that we're not seeing a whole lot of chatter about pre-election. Stephanie, anything else?
Public health is probably a big gap for me. Like the NDP did have that in their platform. We'll see what the Liberals come out with on that. Coming out of a pandemic, I would have expected a bit more from even just commitment to look at everything that happened during COVID with the individual public health units and do a bit of an analysis and report to strengthen it for future pandemics, that kind of thing. That was not in the budget. It hasn't been in the last 3 budgets. So I would say public health, and see what the Liberals come out with on that.
Thanks, Steph. Dan, maybe the next question is for you. When you gaze into your crystal ball, what does a PC minority government look like?
I don't think there's going to be a PC minority government. I think it's been pretty clear in how Stephen Del Duca and Andrea Horwath sometimes danced around this question, and sometimes given some more straightforward answers than you'd expect. That I think if the PCs win a plurality of seats but not a majority, and combine the Liberals and the NDP can find a way to work together, that they would find an agreement to put themselves in government, whether that's through some kind of structure like you've got in Ottawa today, or a more formal coalition, I think is unclear, and that would depend on the election outcome. But I don't think, given the current dynamics, that a PC minority government would be sustainable. Stephanie, I don't know if you have an alternative.
No, I don't think it's going to happen. So.
Okay, a couple of comments about long-term care, not really questions. There's a comment just about there hasn't been any significant increase in staff in long-term care, only commitments, not real change. I mean, we could go down this rabbit hole. I think there's a whole lot to say. I think the HHR issue is a real challenging one. Certainly one that I know the OLTCA and the operators have been talking about for some time, just about the need for more staff. You can have more funding, but if there isn't more people, it's exactly why I think government's been investing in PSWs. But it's also why I think if there's a place for the federal government, it may be for them to think about a national HHR strategy, so that we're not sort of robbing Peter to pay Paul, so to speak. There's another comment about the long-term care builds. And maybe if I simplify it, do the parties indicate any understanding of the extent of the challenge regarding capital funding or the rising costs of construction? I feel like that's a rhetorical question of sort. I think as the folks on the line know, who are pretty engaged in this, it's pretty complicated to build a long-term care home. It's quite expensive. Obviously, inflation has had a huge impact. So it's not as simple as some would make it out to be. But platforms and politics is often about making things as simple as possible. I don't know if Dan or Stephanie, you have anything to add on that particular point?
I think it's not unique to long-term care. I think it's across the infrastructure projects that the construction costs are rising, obviously. And you also have that combined with the Association of Municipalities of Ontario saying we can't keep paying for this and we can't pay it at X amount because they don't want to raise taxes ahead of municipal elections. So it's an interesting sort of debate that I think we'll probably see more of coming out in the next few weeks. But nothing signaled specifically on this in the platforms.
I just note that I think it's pretty obvious that if you commit to a bunch of long-term care homes built by hospitals, that those are going to cost a lot more. And I don't think the government has fully thought through the implication of responding to the COVID issues, suggesting that there should be more collaboration between hospitals and long-term care, and understanding that that is creating a new and fundamentally different and elevated cost structure from how they've been building more community-based long-term care homes in the past. And there's another question about smaller, long-term care homes that would also have a different cost structure if you're moving to smaller settings with different models of care, as the Long-Term Care Commission recommended. So moving from a more monolithic funding approach to long-term care to having a variety of different funding approaches to respond to community need, I think is challenging for an administrative bureaucracy to adapt to. But it's clearly something that there's demand for and that they're going to have to tackle over the next couple of years.
Thanks, Dan. Quick pivot to mental health. There's a question just about the absence of a focus on mental health and addictions in the budget, perhaps in the platforms as well. Maybe I'll kick it off, Steph, and then pass it over to you. I didn't talk about it on the slide that just talked about those top 3 election issues, but at the bottom of that slide was mental health and addictions. So only 10%, I think, was the number identify mental health and addictions as one of the top 3 election issues. Public opinion absolutely drives policy sometimes. I think if you're in mental health and addictions, I think people always talk about it. Occasionally, mid-pandemic, there was certainly a pretty big focus on the impact of COVID on mental health and addictions. But I think it's true that if we want to move the needle, or if we want to see more funding in mental health and addictions, there needs to be a real focus to get government and the other parties to move to start talking about it and make bigger investments in mental health and addictions. Steph, anything to add?
I think if I can be so bold, that the budget speech didn't do a good job on sort of explaining the last 2 years and all of the massive investments that the government made. And it didn't change the channel as best as it could have to sort of the affordability and infrastructure piece that they want to be, going into the election with. So I do think it was a missed opportunity to mention it in the speech, because it is top of mind for most Ontarians. And I hope that, we see more coming out of sort of the next few weeks in this space. But again, it is difficult to sort of summarize absolutely everything in a fairly short speech, and that the government has just recommitted to their roadmap to wellness. And didn't really unveil anything new in the budget.
Thanks, Steph. Any thoughts on how the Green Party might fare in this election, especially if there's some tight vote splits between the NDP and the Liberals? I don't see them making any huge inroads. There was I didn't talk about them on my slides, but despite having gained a seat in the last election, they remain a relatively unknown, and so I guess we'll see if they're able to break through. But in the current environment, I wouldn't expect any gain, and potentially even losing. But Steph, you might have something else to add.
No, I agree with that.
Okay, we are on the hour and we are out of questions, which is perfect timing. So thank you so much, Stephanie. Thank you, Dan, for your time. Thanks to those Santis folks, Taryn and Hannah in the background, for doing the logistics for us. And most importantly, thank you to all of you for joining. Happy to take more questions. Again, if you need some help, support, you let us know. And otherwise, we wish you well over the next 4 weeks, and enjoy the popcorn. Thank you.